Welcome to Arirang Live. It's after 2 p.m. here in Seoul, and I'm Kim Dami. In just a minute, we're going to cross over to the latest briefing from the Korea Disease Control and Prevention Agency on the COVID-19 outbreak. The number of new cases dropped below 600 to 583 on Saturday. Among 559 local transmissions, 400 were from the Greater Seoul area and 24 cases were imported. But with cluster infections popping up all across the nation, health experts warn that the number could soar to 1,000 in the coming week. To curb the spike in the Seoul metropolitan area, the city of Seoul announced a virtual shutdown after 9 p.m. for 2 weeks starting Saturday. The original Level 2 social distancing measures required coffee shops, indoor sports facilities, and gyms to close at 9 p.m. But from Saturday, large stores, PC rooms, study cafes, amusement parks, and department stores will have to be closed after 9 p.m. as well. The briefing has just begun, so let's take a listen.
중앙방역대책본부 상황총괄단장이
Currently, we
진행하겠습니다.
have Director Im Soo-kyung with the briefing. Let us now begin a regular briefing on the COVID-19 situation here in South Korea. As of December 5th, Saturday, we have a total of 559 new local infections and 24 new imported cases. The total caseload now stands at 36,915. We have 306 more people making full recovery, while 7,458 people still remain in quarantine. And there are 121 patients with severe or critical conditions. We have 1 additional fatalities. I extend my deepest condolences to the deceased. And let us go over our major updates on our regional outbreak. And in relation to a musical theater in the Seongbuk-gu district in Seoul City, we also have additional cases of 16 being confirmed. And in total, we have 17 cases being confirmed to date. In relation to a wine bar at Gwangju district, Seoul City, we also have the first index case being identified on the 29th of November, and we have 20 additional cases, raising the total to 21. In relation to a restaurant in Jongno-gu district, we have 21 additional patients being confirmed. In total, we have 55 cases being confirmed to date. In relation to a university band club in Seongbuk-gu district, we have 2 additional cases. And in relation to an insurance company in Kurogu district, we have also identified that 19 more cases have been confirmed, raising the total to a total of 20. And in relation to a real estate company in Yeongdeung-pogu district, we also have a case identified earlier last month, and we have 27 new cases, and in total we have 28 cases. And in relation to a call center in Chunggu in Seoul City, we have also the confirmed cases of 8 more people, raising the total to 9. And in relation to a table tennis club in Songpa-gu district, we also have identified that 21 additional patients have been confirmed. Currently, we have a total of 22 people being confirmed to date. In Gangnam-gu district, we have the call center, and in relation to this place, we have 14 additional patients. And in Dongdaemun-gu district, we have the hospital and clinic. We have 6 additional cases being confirmed, and in total, we have 31 cases to date. And in Gangseogu district, in relation to dance lessons, there we have identified 9 additional cases. And in relation to a nursing hospital in Bupyeong-gu district in Incheon City, we have identified that 19 additional cases have been confirmed. And in total, we have 20 cases to date. And in relation to Bucheon City in Gyeonggi-do province, in relation to a university hospital, we have 4 additional cases. And in Daejeon Yuseong-gu district, in relation to a pub, we have 15 additional cases being confirmed. In total, we have 40 cases to date. And in 전북, Jeonju City, Deokjin-gu district, in relation to a church there, we have identified that 16 cases have been confirmed in total. In relation to Changu lessons in Busan and Ulsan cities, we have 7 additional cases. And as for the quarantine measures right now, it is very important to trace any and identify any earlier patients of the COVID-19. And it is very important that we also need to carry out proactive testings of any people who are showing suspected symptoms. And if anyone with suspected symptoms have visited a clinic, he or she will be directed to the screening clinic without complicated procedures. And with the massive spread of the COVID-19 and in order to contain the virus going forward, it is very important to minimize local transmissions and also physical contacts and cut off the chains of transmissions. So if you have any suspected symptoms like fever or coughing or any other respiratory symptoms, please go to a nearby clinic or screening clinic or a designated respiratory disease clinic and get tested as soon as possible. And next, we would like to introduce some of the cases that have been reported at the safety e-report. And in relation to major breaches, there were some centering around the non-compliance with mandatory face mask wearing and also no abidance to the social distancing measures. And also there were some reports in relation to the ventilation breaches as well. So here are some examples. And there were a case in which a restaurant did not ventilate the space, and the visitors also did not wear face masks when they were waiting for their food. And also there was a study cafe which does not have a supervisor, and also they did not wear face masks properly, and they did not also have any limitations or restrictions. And at schools or Pilates schools or instructions, they did not wear face masks or they did not have proper ventilation services. And also before identifying and being confirmed with the COVID-19, we also have many exemplary examples where people did also wear face masks properly at churches, and they went to the churches and there were 3 people and they went to the regular services and they all tested positive. However, and we have seen that all of these 3 people wore face masks properly, and all of the other service members also wore face mask properly. So only these 3 confirmed cases have tested positive. However, after testing all of these 700 service members, we did not identify any additional positive COVID-19 cases. And this example has also been introduced by our card news from our health authorities, and please refer to this press kit as well. And as for the massive preemptive testings carried out at nursing hospitals, here are our middle term analysis. And in Seoul, Gyeonggi, and Busan, we have identified at 9 facilities, we have identified 103 positive cases so far. And after we carried out the regular testings as well in Seoul and Busan at 5 facilities, we have additionally identified 10 additional patients. Currently, we have finished the Sunung exam. However, these test takers also need to continue to comply with the quarantine measures. And this comes as there are still many interviews as well as essay testings at the universities, and therefore we are seeing in the upcoming weeks and days we will see many movements of people and also congregation of many students and test takers as well. And during the first and second weeks of December, we will also have these test takers being clustered in the Seoul metropolitan area, and thus increasing the risks of infection. So even after the Sunung exam, we ask you to also minimize any social contact with your friends and relatives. And the COVID-19 outbreak, the speed of the infections is spreading very fast, and on average during the past week we have seen that the average cases were about 487.9 cases, which is about higher than the previous week by 80 cases. And we are also predicting these future outbreaks as well. And the reproduction rate was about 1.4 for the past week. This means that one confirmed patient could and is infecting about 1.4 people. And if we are not able to lower this index to by 1.2, it is very difficult for us to contain the virus going forward. And we also analyze the movement of foot traffic, and we have seen that the intensified social distancing measures is reducing the foot traffic by about 20%. And if the social distancing measures are also abided by stringently, we are also expecting that there could be a decrease in the local cases and transmissions. However, we do not see that the effects of social distancing measures have fully unfolded as of yet. And moreover, we are seeing cluster infections in the metropolitan area, so it is very important and very crucial for us to have movement restrictions in the capital area. And next, we also look into epidemiological investigations, and we have seen that 20% of the total cases are under investigation. And this is also increasing on a weekly basis. And we are currently working with the local governments and the central governments, and we are also sparing no effort to trace the contact cases. However, there are numerous and massive people and contacts. And we have seen that there are many small cluster infections, many sporadic ones as well, and they are spreading to our daily lives and also throughout the entire nation, including group meetings and pubs and private academies, as well as university college clubs. We are seeing a massive outbreak throughout a very small cluster infections. And compared to the past when we had first and second major outbreak, it is a very different story right now during the third outbreak, as we do not have a central cluster infection. However, it is spreading at a very fast pace and it has numerous clusters. In other words, this means that the cluster infection can take place at any places near our daily lives, and also it could be one of our loved ones or one of our relatives or acquaintances going forward. So it is very important for us to avoid a possible medical collapse and also decrease the damages on the self-employed as well. And this can only be possible if we comply with quarantine measures. It is very important for us to take bold actions, and it is a very critical juncture as well. And this dedication and this bold action involves not going to any social gatherings further, and also refraining from movement as well. And during our daily lives, there are many routes of infection. It is very important for us to curb these routes of infection, and this is only possible if the rest of the public cooperates going forward. We ask you to comply with these measures going forward until year end. And the quarantine authorities will also make sure that you could also contain the virus, and especially through these special quarantine measures, we carry out massive testings and comprehensive testings to trace down any possible patients. And we are also revising the guidelines for the screening clinics, and we are also testing people with suspected symptoms, suspected respiratory symptoms, and we are giving them free testings as well. And we are noting that the infection can begin before one shows symptoms, so it is very important for us to trace down any patients at an early pace. And so if you have any cold-like symptoms, please get tested at a screening clinic as soon as possible. And the government is also making sure that starting from December 7th to January 3rd, we have designated this period as the special holiday quarantine period, and we will exert our full efforts. Thank you very much.
There you have it. We'll bring you more details on the briefing in our upcoming newscast at 6 p.m. Korea time. Until then, goodbye.
COVID-19 has penetrated our daily lives. Sporadic outbreaks are occurring through everyday activities. Infections are spreading through all kinds of gatherings. Everyone's cooperation is needed to stop the spread of the disease. Avoid gatherings and meetings as much as possible, especially gatherings involving dining and drinking, as the risk of infection is high. When attending a gathering is inevitable, make sure to wear a mask at all times, even when having a conversation. Preventing the spread of the virus and protecting those we care about, following the prevention guideline, is essential to protect our daily lives. Let's all stick to the basics.
바람찬 흥남부두에